So here is a video based question in which there is an elderly woman with ptosis, bilateral ptosis, as you can see, and the examiner is trying to kind of elicit the gaze here. He's asking her to look down and he's taking up, and there is some twitching sensation when her gaze returns back to normal. So what kind of sign it is the question here. So to begin with, so this video based question is from the topic kind of ocular findings seen in case of myasthenia gravis. See, it is evident elderly female with bilateral ptosis is a dictum that she might be suffering with myasthenia gravis. And what is this myasthenia gravis? Myasthenia gravis is a generalized muscular weakness and also fatigue of the muscles. It is an autoimmune disorder, we all know. It is an autoimmune disorder, and there is damage to acetylcholine receptors. So there is development of antibodies, acetylcholine receptor antibodies in this myasthenia. And what about ocular manifestations of this disease? Very importantly, you need to remember ptosis, which is bilateral, okay, plus the other ocular finding which is very important in this case is failure of convergence of the eye are the first ocular manifestations seen in case of myasthenia gravis. So this ptosis is bilateral, and whenever you ask a patient to for increased prolonged fixation of the eye, and when you ask her to look upwards, you will really see the severity of the ptosis increasing. Okay, and also there is an effective compensation by like kind of overreaction of the frontalis is impossible. They cannot compensate because of the even the fatigue of the frontalis muscle. Also, they cannot maintain the proper eye gaze. There will be ptosis in these cases. What are the late findings in this? Even not only levator palpebrae superioris, okay, even extraocular muscles of the eye are also affected in this case, leading to ophthalmoplegia. Okay, so one of the ocular finding in myasthenia gravis is also ophthalmoplegia externa, which occurs in almost 50% of the cases. Only extraocular muscles are affected, not intrinsic muscles are usually not affected in this case. So the diagnosis is done by edrophonium test. If you have any doubt, if you cannot diagnose it clinically, you can do edrophonium test, which actually helps in improving the ptosis. Okay, this edrophonium is a rapidly acting one and it is quickly hydrolyzed, so you can get quick results with this. So this is the basic of whatever we have just discussed, that is myasthenia gravis ocular findings. And what is this characteristic sign then, which you see here? The most sensitive and specific test to diagnose what I say the myasthenia gravis, ptosis in myasthenia gravis, is the Cogan lid twitch test. Okay, Cogan lid twitch test, and this sign is Cogan lid twitch sign. So in 1965, there was Cogan who first described this eponymous lid twitch as a sign of myasthenia gravis. And how to elicit this sign, as you have seen in this video, it is elicited by instructing the patient to maintain downward gaze for about 15 seconds. Then ask her to gaze upward, and finally ask her to return back again to the primary gaze. So in patients with a positive sign, that is in patients with myasthenia gravis, the observer will notice that upper lid produces a definitive upward twitch or overshoot. Remember this twitch or overshoot. To be frank, in this video it is not clear, but just by looking at the female and all, and also ruling out other options, you can come to a conclusion that it is Cogan lid twitch sign. Okay, so the twitch or overshoot, this twitch or overshoot, what I say, why or how it is seen, like what is the physiological basis for it? The physiological basis for this overshoot is unknown, but you can infer from the following statement. If I say patients with myasthenia gravis have muscle overactivity, So the reason, definitive reason is unknown, but proper explanation can be, closest explanation will be, patients with myasthenia gravis have muscle overactivity. So that is evident with this positive Cogan twitch sign. So the eyelid retractors, because of the muscle overactivity, so the retractors of the eyelid, they overshoot here. Okay, whenever there is a return from downward gaze to the primary gaze, they overshoot, producing this Cogan lid twitch sign. So let me look at the other options before closing it up. So it is evident that this is not definitely Moebius sign. Moebius is convergence. The convergence is not produced here. And Moebius sign, where it is seen, this is sign seen in case of Graves' ophthalmopathy. What are the other two phenomenon? One is Herring phenomenon. Herring phenomenon is seen in not bilateral ptosis, it is unilateral ptosis. It is closest for confusion. Okay, this option. So what is Herring phenomenon? In cases of unilateral ptosis, for example, if right eye is the one which is getting affected, okay, ptosis is like upper eyelid partially covering it. In cases of unilateral ptosis, the contralateral lid may assume a ptotic position upon occluding the eye with ptosis. Okay, so when you try to occlude the ptotic or the eyelid which is affected with ptosis, the opposite eye will also produce or also acquire a ptotic position even if it is normal. This is known as Herring phenomenon, because bilateral innervation of these muscles. So I don't want to go into the details, but Herring bilateral innervation theory is there, which says if you occlude this, even this will also go into ptosis, though it is normal. The last but not the least, very important from ophthalmology perspective, what is this Uthoff's phenomenon? You need to understand that this Uthoff's phenomenon is seen in demyelinating disease, that is multiple sclerosis. The other sign which is seen in is Hermitage sign. Hermitage sign and Uthoff's phenomenon are characteristic of multiple sclerosis. And why do we discuss multiple sclerosis in ophthalmology per se? Because in the most common nerve which probably gets affected is optic nerve. Okay, so this Uthoff's phenomenon is related to heat. That is, heat sensitivity symptoms are seen in multiple sclerosis. That means whenever a person takes a hot shower or whenever a person is physically exercising, okay, hot shower, or whenever a person is physically exercising, physical exercise, extensive exercise, in these cases the person will have unilateral blurring because the heat is aggravating the symptoms. Okay, this heat dependence of the symptoms of multiple sclerosis is the Uthoff's phenomenon. So this will conclude our discussion on this video based question, which is Cogan lid twitch sign.